Have you heard of small intestinal bacterial overgrowth, but you're unsure of what it is? Many think that common symptoms like gas and bloating are just the occasional annoyance that everyone deals with. You may even think that for yourself. But if you aren't familiar with SIBO, now is the time to learn what it is so that those symptoms don't become something more significant for you later. Hi, I'm Dr. Arland Hill. If you're listening to this video, chances are you've stumbled onto the term small intestinal bacterial overgrowth. Now, this is often simply abbreviated SIBO or SIBO. Now, here's what you should expect after watching this video. You'll have a better understanding of what a case of SIBO looks like, what symptoms are connected to it, what differentiates it from other conditions of the gastrointestinal tract, and why taking action immediately if you think you have it is a must. Now, before we delve into this information, if you also want to see videos to help diagnose and effectively and permanently manage your small intestinal bacterial overgrowth, make sure you hit that like and subscribe button so you can see more videos on these topics in the future. So, let's jump into this. Let's get to why you're here today. Small intestinal bacterial overgrowth. This is one of the most common conditions of the gastrointestinal tract. And unfortunately, it's often overlooked by many in the population, both lay individuals and professionals alike. But it typically comes with some very annoying symptoms: gas and bloating, feeling full and satiated quickly after eating, tenderness in the abdominal area that generally doesn't have a good explanation for it. These are the kind of things that are often linked to small intestinal bacterial overgrowth. Now, fortunately, this is not always the case, but fortunately in this conversation, the name is very descriptive for the state of dysfunction. So let's just simply use that as a roadmap to help you better understand what's going on. Well, small intestine, that's just past the stomach, but above the colon. So it's the area of your gastrointestinal tract in between. That's where we're predominantly talking about the issue being located at. And why is this so significant in the small intestine? Well, the reason is that normally this is a very harsh environment. We've just released acid in the stomach, and that is moving into the small intestine, what's typically called chyme there. That's moving into the small intestine. And then once it gets there, you're releasing bile acids from your gallbladder, enzymes from your pancreas. These are all very difficult things for bacteria and microorganisms to navigate, and they typically are reduced in number significantly in this environment. But this is not the case with SIBO. In the case of small intestinal bacterial overgrowth, they're overgrowing. Now, we're talking about bacteria here, so let's move on with the name. We're past the small intestine into bacteria, and bacteria are the predominant organism in the gastrointestinal tract, but they're not the only organism, and regardless, they shouldn't be in excessive numbers here. So what's happening is that the number of bacteria are exceeding what's normally present in that environment, and they're exceeding it by up to 1,000 times more, 1,000 times or more bacteria. So we're talking about a significant amount. But here's what's also important. It's not just that the bacteria are overgrowing and that they're significantly present in number. It's also that we have the wrong type of bacteria present. Often what are termed as colonic bacteria, bacteria that do tend to hang out more in the large intestine, begin to populate in the small intestine. We also see shifts in the type of bacteria going from things known as gram-positive to gram-negative. So the point is that the types of bacteria change just as much as there's an overgrowth. Oh yeah, and about that overgrowth term, well, that's important too. This is not an infection. We're not trying to eradicate here, so this is different, and it should be pointed out that it should be managed differently than an infection as well. And that means that there's going to ultimately have to down the road be some follow-up once we get this overgrowth under control. And this is often more dealt with antibiotics or what are termed antimicrobials, but the strategy has to be bigger than that. Now, what does SIBO, small intestinal bacterial overgrowth, what does that actually look like? Well, I want you to think about Thanksgiving dinner. You sat down at the table, you had this huge spread of food, and you overate. You knew you were going to overeat, and you did it anyway, and now you're paying for it. You've got to unbutton the top button of your pants, you're bloated, you're uncomfortable, you've probably got gas because you're eating things that you don't normally eat on a daily basis. This is what SIBO looks like, but imagine this being your routine and not just once a year. So I'm going to share with you two different examples of SIBO. And so the first one I'm going to give you here is the names have been changed to protect the innocent, if you will, but these are actual examples that I have dealt with. And so the first one is Stacy, and Stacy, mid-30s, had a history of obesity, decided to undergo bariatric or weight loss surgery, and was successfully keeping the weight off, but noted that even with the exercise, she was having difficulty gaining muscle. She had persistent diarrhea, just didn't seem to want to let up. That classic bloating and gas that was always present after eating, unexplained, didn't matter what she ate. And when I did lab testing with her, I found that she had multiple nutrient deficiencies. And that's what SIBO can look like on one hand. But on the other hand, I want to give you another patient named Jan. And Jan was an aging female, had lots of stress in her life, mostly psychiatric, neuromental, emotional stress, however you prefer to say that. She routinely works out 5 days per week, had struggled with cycles of bloating and gas. They would come, the gas and bloating would be present. It would get better for a while, but then it would come back. And all the interventions had temporarily yielded some relief, but she relapsed back to where she was. And needless to say, after doing this for a year and a half, she was frustrated that there was no real answer for her. Well, we would all be frustrated too if that was us sitting in that situation. So she wanted to understand what was going on. So these are very real examples of what SIBO can look like, even though these two individuals don't sound anything alike. So can these symptoms overlap? Yes, they can. And there's some similarities here, but many times with these symptoms, they're often termed as unexplained. But these symptoms typically become very straightforward in that there's bloating, feelings of fullness, and you don't have to check all these boxes. It's just a couple here that you need. But bloating, feelings of fullness, gas, weight loss, and that can be related to malnutrition, nutrient deficiencies. It often comes with having weakness associated with it. Your general disposition is that you just feel weak and apathetic. But on the other hand, that's weight loss. There could also be weight gain as a byproduct of the imbalance of the organisms in the gut, what is typically termed dysbiosis. Some individuals will experience diarrhea with this, and they can have just unexplained pain in the abdominal region. It just doesn't make sense as to why they are seeing that. Now, I told you I was going to tell you what was different in relation from SIBO as it compares to other disorders of the gastrointestinal tract. And one of the main differences is that small intestinal bacterial overgrowth is often overlooked or undiagnosed. Many practitioners don't acknowledge the significance of this condition and don't give the patients a protocol or a strategy of how to help manage it and deal with it. Again, those aren't just annoyances that you're dealing with for gas and bloating and feelings of fullness and the discomfort in your stomach. There's something bigger going on there. And it's important to note that these aren't just a reaction to food. It's not just, some people might call it, well, it's IBS. It's not IBS. This is a different scenario altogether than IBS. Yes, they do overlap. They can overlap a lot. In fact, the number on that's about 75% overlap, but it is different than IBS and has to be managed differently than IBS. And most importantly it's not a disease. Now, it should be noted that it has been linked up to other conditions. So it can be a forerunner to other conditions, and this is why I started off saying that if you're just not paying attention to these symptoms, you got to stop doing that, because this is leading you down a road to where you're likely allowing something to develop more serious that you don't want to deal with either. So it can be a very slippery slope into other conditions, and you can see things like Crohn's disease, autoimmune disease, ulcerative colitis. There's associations with even links into things like liver dysfunction, progressing all the way into cirrhosis, celiac disease. In fact, individuals that don't respond to a gluten-free diet, often if it's celiac or suspected celiac, many times they'll respond to managing their small intestinal bacterial overgrowth. Skin conditions are tied in here. Even things like Parkinson's disease and low thyroid function, restless leg syndrome. Guys, these are all things that you have to be thinking about that could potentially be coming down the road by not paying attention to those annoying symptoms that you have now. So, after delivering on the information that you stuck around for, here we are at the end of the video. We got you all this information you needed to have a better understanding of what small intestinal bacterial overgrowth is. Now, I'm sure you want to know more, and what is next? What do you need to do next? So with you in mind, I have a video here that I'll share with you the one thing stopping you from being better when you have SIBO. Take a look at it. You'll be glad you did.